What if your body already knows something's wrong before you do? We all like to think we know when something serious is happening inside us. Maybe a sharp pain, a dramatic change. But what if the first signs aren't loud at all? What if they're more like whispers, barely there, easily brushed off? That little cough that lingers, the fatigue you blame on poor sleep, a slight change in your bathroom habits. You tell yourself it's nothing. Just getting older, right? But what if those small changes are actually your body's early warning system? The truth is, many serious health problems don't start with big alarms. They begin quietly, subtly, and recognizing these quiet warning signs early, before they get louder, can make all the difference in catching something in time. So today, we're going to listen closely to what your body may be trying to tell you. Not the shouts, the whispers. Because instead of waiting until something becomes urgent, wouldn't it be better to catch it when it's still manageable? Let's be clear. This isn't just a list of symptoms. This is your personal health checklist, a guide, a gentle but powerful reminder that your body is always speaking. You just have to know how to listen. Think of this video as your own fast-track diagnostic tool. No scary language, no overwhelming medical talk. Just real signs, real meaning, and what to do about them. Because knowledge is power, but only when you know what to look for. And if even one of these quiet signs sounds familiar, this might be the wake-up call you didn't know you needed. Let's talk about the quiet thieves, the symptoms that slowly drain your energy, your clarity, your spark. They don't knock you down all at once, but day by day, they chip away until you barely recognize how tired, foggy, or worn out you've become. Sound familiar? Let's start with fatigue. Not the kind that comes after mowing the lawn or staying up too late. We're talking about deep, persistent exhaustion. The kind that doesn't go away with a good night's sleep. It lingers. You wake up tired. You move through your day like you're dragging a heavy coat you can't take off. This kind of fatigue is more than aging. It can be your body waving a flag for something deeper. Maybe a thyroid imbalance, a vitamin deficiency like low B12 or iron, or even a chronic condition like lupus. In fact, a 2025 study showed that people with autoimmune conditions often experience fatigue long before any other symptoms appear. It's not just in your head, it's a biological warning signal. Now let's connect the dots to unexplained weight loss. For most people, dropping a few pounds sounds like a bonus. But when it happens without trying, no changes to your diet, no extra exercise, it's a red flag. Your body doesn't shed weight for no reason. It might be something as manageable as an overactive thyroid, or it could point to something more serious, like cancer or chronic infections. The key is this. If you're losing weight without explanation, especially if it's more than 5% of your body weight over a few months, don't ignore it. Ask yourself, is this something I chose or something that's choosing me? And finally, we come to headaches. Everyone gets them from time to time, but when they become frequent, change in intensity, or start appearing with other symptoms like blurred vision, nausea, or confusion, it's time to listen up. Migraines can be disabling, but headaches can also be a sign of high blood pressure, infections, or even neurological conditions. One key difference? A new kind of headache that feels different from your usual pattern. That's your cue to call a doctor. Here's the big picture. Fatigue, weight loss, headaches. They're often brushed off as stress, age, or just one of those things. But instead of explaining them away, what if we saw them as what they really might be? Whispers of imbalance before they become cries for help. Because instead of treating these symptoms like background noise, wouldn't it be wiser to tune in now, while it's still early? Some signs don't hurt. They don't stop you in your tracks, but they quietly disrupt your routine, like water leaking from a pipe behind the wall. You might not notice at first, but over time, the damage builds. Let's start with one of the most overlooked, frequent urination. Most of us don't like talking about bathroom habits, but your bladder has a story to tell, especially if you're going more than usual, particularly at night. If you're waking up twice or more to use the bathroom, it's worth paying attention. It could be a simple urinary tract infection, especially common as we age, but it could also be a sign of diabetes. When blood sugar runs high, the body tries to flush out the excess through urine. And in older adults, this can sometimes be the very first sign. In fact, a 2025 study on older patients with type 2 diabetes found that those over 65 with high HbA1c levels had a significantly increased risk of recurrent UTIs and urinary incontinence. What feels like just getting older might actually be your body trying to regulate something deeper. Then there's digestive issues, gas, bloating, irregular bowel movements. Most of us chalk these up to something we ate. But when these problems linger or become a pattern, they might mean more. Conditions like irritable bowel syndrome or inflammatory bowel disease can creep in quietly. You may think it's just age, but data says otherwise. A 2025 national survey found that people with IBS lose an average of nearly 4 full days a month in lost productivity or missed activities due to their symptoms. That's not minor. And here's what's more concerning. Persistent bloating, cramping, or changes in stool can also be early signs of colorectal cancer. While it's more common in older adults, we're now seeing an increase in cases under age 52. But there's hope. New technologies in 2020, like colonoscopex, are combining blood biomarkers and artificial intelligence to detect colorectal cancer before symptoms fully develop. Meaning the earlier you flag something, the sooner help can arrive. So here's the question. How often are you going to the bathroom? How often are you dealing with bloating or irregularity? Is this your normal? Or could it be your body's way of saying something isn't quite right? Because instead of living with silent leaks, night after night, meal after meal, what if you paused and asked why? Sometimes the most ordinary discomforts are trying to start an extraordinary conversation. Breathing, it's automatic until it's not. And your heartbeat, you barely notice it until it acts out of rhythm. That's the thing with chest symptoms. When they show up, they can feel scary. But more often than not, they arrive quietly in ways we dismiss. Let's begin with the persistent cough. A cough that lasts a few days with a cold, that's normal. But when a cough sticks around for more than 8 weeks, it's time to ask why. It could be asthma, it could be postnasal drip or acid reflux, but it could also be a sign of something far more serious, like chronic lung disease or even lung cancer. A 2025 study followed patients after lung surgery and found that persistent coughs can linger for over 6 months, not just as a side effect, but as a marker of deeper respiratory distress. And yet, nearly half of patients in another survey said they ignored their coughs for weeks, assuming it was allergies or the weather. Then comes shortness of breath. It's easy to overlook. You go up a flight of stairs and feel winded. That happens, right? Sure. But what about when it happens sitting still or brushing your teeth? Shortness of breath, especially when it's new or worsening, can be a major warning sign. It may point to heart failure, COPD, or even a pulmonary embolism. And in many older adults, this symptom arrives before any chest pain does. So if you find yourself slowing down, not because you choose to, but because your lungs or heart demand it, don't ignore it. And speaking of the heart, let's talk about chest pain. This is the one we fear most. But here's what's surprising. A 2025 emergency room study showed that only 9% of chest pain cases were linked directly to the heart. The majority were musculoskeletal or digestive in nature. So chest pain doesn't always mean heart attack, but that doesn't mean it's safe to brush off. In people with diabetes especially, chest pain can show up in unusual ways, like a dull ache in the shoulder, nausea, or just shortness of breath. You might not feel the classic elephant on the chest, but that doesn't mean your heart is fine. The body doesn't always send pain where the problem is. That's why these signs matter. A lingering cough, a breath that doesn't come easy, an ache you can't place. They may not be dramatic, but they're not random either. So instead of saying, it's probably nothing, what if it's something? Something you can get ahead of. Something you can still do something about. Because when your breath and your heartbeat start to whisper, you owe it to yourself to listen. Your eyes and your skin, two parts of the body we see every day. But how often do we really look at them? The truth is, these two areas often reveal the first signs that something inside is going wrong. Let's start with the skin. A new mole, a small change in color, a rough patch that wasn't there before. Maybe you chalk it up to age. Maybe it's just a dry spot. But sometimes those tiny changes are warning signs. One of the most treatable cancers, skin cancer, also happens to be one of the easiest to overlook in its early stages. But here's the good news. Early detection saves lives. According to a 2025 clinical study, a new AI-powered tool increased dermatologists' ability to identify potentially dangerous skin lesions from 81% to 94%. That means even small changes when spotted early can make all the difference. Here's the rule. ABCDE, asymmetry, border irregularity, color variation, diameter larger than a pencil eraser, evolving over time. If your mole or skin spot fits even one of these, it deserves a closer look. Now let's move to the eyes. Blurry vision, flashes of light, a sudden shadow in your sight. These things might seem minor, but they're not. One of the most serious conditions here is a detached retina. If not treated quickly, it can lead to permanent vision loss. And it can start with nothing more than a little flicker or floaters drifting across your vision. Other causes of sudden vision changes include macular degeneration, glaucoma, and complications from medications. In 2025, several reports linked vision disturbances to popular diabetes drugs like semaglutide, used for weight loss and glucose control. 9 patients reported new visual problems, some tied to swelling near the optic nerve. The eyes may be small, but they're connected to nearly every system in the body. And new research shows that AI can now analyze retinal images to detect early signs of disease with an accuracy nearing 95%. But you don't need fancy equipment to start. You just need to notice. Look at your skin. Notice that mole. Feel the change in your sight, because instead of waiting for the world to go dark, wouldn't it be better to act while the lights are still on? So let's take a breath and quickly go over what we've learned. We talked about 10 quiet signs: fatigue, weight loss, headaches, changes in urination, digestion, coughing, shortness of breath, chest pain, changes in your skin, and your vision. None of them shout, but together they paint a picture your body might be trying to show you. If even one of these sounds familiar, don't ignore it. And if this video helped you think differently about your health, consider sharing it with someone you care about. You might just help them catch something early too. Here's what's exciting. 2025 isn't just another year. It's a turning point in how we catch disease before it strikes. New AI-driven tools like colonoscopes are changing the game. This system can analyze blood data, lifestyle history, and subtle biomarkers to spot early-stage colon cancer before symptoms even appear. And in eye care, machine learning models now scan retinal images with over 90% accuracy, detecting early signs of disease from just a single snapshot. No needles, no pain, just smart prevention. Even blood tests are evolving. One new study used free-floating DNA and epigenetic markers to detect colorectal cancer with near 90% precision. Imagine getting screened for cancer in a routine blood draw. The message is clear. The science is getting faster, smarter, and more precise. But that only works if you listen to your body and take the first step. Because the future of health isn't just high tech. It starts with awareness. If your body has been whispering, now is the time to listen. Don't wait for the symptoms to scream. Don't brush them off as just getting older. Because what seems small today could mean something tomorrow. And catching it early changes everything. So if even one sign from this video feels familiar, talk to your doctor. Ask questions, get answers, stay ahead. And if this video helped you, share it. You never know who else needs this message. Maybe a friend, a parent, a neighbor. Sometimes one quiet reminder can save a life.